Loading up, and we are live. Awesome. All righty. So, hi everyone. Hi everyone on Facebook. This is Danelle Dixon, Performance Plus Physical Therapy. This is Q&A with Dr. D, and I have a very, very, very special guest. I'm going to actually let her introduce herself because she's going to do a way better job than I am. But
plus, you don't want to say my last name.
I'm sorry?
Plus, you don't want to say my last name.
I do not want to mess up your last name. So this is Miss Heather. I met her recently. She's an amazing occupational therapist that works with musicians. And we connected because I really wanted to have someone come in for my Q&A with Dr. D, who's familiar with the hand and wrist, but wanted to look at someone with a specialty audience, which is musicians. Not to say that she doesn't treat other people, but her thing is, working with musicians, which is very ancillary to me working with dancers in terms of the performing arts world. So I want to say welcome, Heather. Thank you for joining us.
Thank you for having me. I'm so excited because, when I look at your background and I look at my background, there are very similar paths.
Mm-hmm.
You have your background in dance and we're a professional dancer. I have my background in music and was a professional musician. We both had injuries and now we're both in healthcare, and now we're both specializing in working with our primary love, our first love, which was for you dance, and for me was music. So it's just really cool to see how our lives are sort of parallel, and that we're then able to go and take what we had happen to us and help our niche and help them prevent injuries and recover from injuries in the first place. So I just think that's so cool that you're doing what you're doing, and that there are people and therapists out there that specialize in these performing arts fields, because there aren't that many.
I know.
And it makes a big difference when you are the patient.
Mm-hmm.
Having a therapist understand you and what you're going through because they've been there and they've done it is a big, big difference.
Agreed. So Heather, we have, I think your background is a little bit unique because you're an occupational therapist. So tell us a little bit about yourself, about occupational therapy, and a little bit about your journey. You alluded to it just now, but tell me a little bit about your journey and how you became an occupational therapist working with musicians.
Okay. So my first love was music performance. I picked up my flute when I was in 5th grade, the standard age. And I knew from the moment I blew into that silver tube that I was going to be doing this for the rest of my life. There was nothing else that I wanted to do. I never thought about anything else. I didn't care about geometry and physics and chemistry. I didn't care. I was going to be a musician. Mm-hmm. So I went on to conservatory and I got my degree in music performance for flute. And I was playing a lot. I bumped up my playing time a ton. I knew nothing about body mechanics. None of my teachers ever taught me about positioning or anything like that at my instrument, fitting my instrument to my body, healthy habits for musicians. None of that stuff was ever discussed in music school because it's just not, our music teachers aren't taught that. I wasn't taught that in music school. So why would they then be able to bring that onto us? Plus, they're not trained in anatomy and physiology and stuff. But it is a huge thing looking back now that needs to happen in schools. Anyways, I digress there for a second. So I ended up with injuries and I couldn't play. So I went from 6 to 8 hours a day of playing, gigging, practicing to maybe being able to hold my instrument for about 10 minutes. So I was kind of faced with the decision. For me, it was always important to be able to support myself. And I also had a limiting belief back then that I see now that I didn't see then, was that if I couldn't do it 110%, then I wasn't going to do it. So I had to stop playing because I have a leftover problem with my finger actually. And I didn't know what I was going to do. I had no idea what I was going to do. So my grandmother said to me, "Why don't you become a physical therapist?" Mm-hmm. And I was like, "I'm not touching feet." So, just like, there's no way I'm touching feet. So, but she kind of started the wheels turning in my brain. Okay, well, what I found OT, and OT is very function based. It's all about function. It's all about analyzing an activity from start to finish, what it needs to happen from a cognitive standpoint, from a neuromuscular standpoint, from all these different angles, so that you know this is everything that has to happen in order for somebody to complete this task. And it's like, well, that kind of goes with like being a musician, and it's a lot of fine motor control. So I kind of went down the path that I wanted to be a hand therapist. And I hate that term, hand therapist, because people think, and in the orthopedic world, everybody knows that a certified hand therapist does shoulder and all the way down. But in the real world, people don't know that. They think, oh, you only do hands. But it's not. It's one of those things that it's an advanced degree in shoulder, elbow, wrist, and hand treatment. So the whole upper body. So that's kind of why I chose OT, and how I kind of ended up down that path of occupational therapy rather than physical therapy. And then I've been in practice for 22 years, and I just started my own practice about 2 years ago. And probably about 70% of my patients are musicians. So in my first job, we had they hired me actually because they were starting a musicians clinic. So I worked in that musicians clinic at that facility, but it was a different environment because we were seeing patients every half an hour. So you couldn't really dive into everything that needed to be dove into with musicians. So so I very holistically, I look at all three areas, the physical aspect, the emotional aspect, the energetic aspect, and how they are at their instrument at the same time.
Okay. Ooh, you gave me like 5 different questions from that.
Sorry.
No, it's good. It's good. Tell me, first of all, where are you located?
I'm in Connecticut, in Collinsville, Connecticut.
Okay.
It's a little town, so northeast corner.
Okay, got it. And then tell me a bit more about your treatment approach. You said holistically, you treat patients from a physical aspect, from an energetic aspect, and an emotional aspect, correct?
Yep.
So tell me a bit more about that.
So OT is very mind, body, spirit oriented. So though in the clinical world, in orthopedics at least, you don't really get to dive into the mind and the spirit aspect of it as much, because again, you're seeing patients so quickly. So I do a lot of when I look at my patients, they bring their instrument, because that's the most important thing. I need to look at how you are approaching your instrument from a physical standpoint, from an energetic standpoint. What is the energy that you're approaching your instrument at? What is the energy that you're approaching your piece at too? So is that increasing your tension? Is it causing you to not breathe well diaphragmatically? And then there's also the subconscious stuff that goes on inside of us, which if I look back at, now that I've done my own healing, if I look back, I can tell you that fear was a big limiting factor for me, and probably one of the big contributing factors of my injury. Because for every thought and emotion we have, I believe that we have a physiological response to that emotion. So if we keep storing these emotions inside of us, we're holding that energy inside of us. And, negative self-talk, whatever, limiting beliefs, all those kinds of things, we can tend to hold on to, things that we're told by society or from other people or from our parents. We can take that and embody that, and then that can create limiting beliefs inside of us and limiting energy, so that we can't actually be in alignment with what we're meant to do. And it can cause physical pain. So, eventually the body will say, "Uncle, I'm done,"
Right.
So it's a matter of really diving into the structural component of their body, how their body is placed at their instrument, because a lot of times their body, everybody's body is different, and every instrument requires some form of contortionism. So it's a matter of being as least contorted as possible, so that you can play your instrument as in a healthy way, and as healthy way as you possibly can.
Got it.
And then making sure that you get out of those deforming positions when you're away from your instrument is another key. And then also doing the inner work to deal with performance anxiety, to deal with the fears and the limiting beliefs that come up, and all that stuff. So that's kind of a lot of the energetic stuff that I do, and just releasing and replacing and shifting that energy inside of them.
That's awesome. So I think in the wider orthopedic world, we would probably look at that as just pain science. How are people, how the science behind the pain, how is pain being interpreted in the body? What somatic connection in terms of, how you're feeling and how that manifests itself in the body in terms of pain, how chronic it is, how acute it is, or when does it come on? There's so many connections there. So it's really interesting that you approach it from that angle. I absolutely love that. Because, and guys that are listening, just so you guys know, as you start diving more and learning more about the body, your body and the things that you need for your body, whether it be a hand injury or an elbow injury or a shoulder injury, a foot, ankle, whatever it is, you're going to start noticing patterns if you're paying attention to how you respond to certain things. And Heather's doing really well to the concept of not just looking at yourself as a part. You're not just in one box. The body is made up of so many different systems that interact with each other, that affect each other. When one system is off, it changes and imbalances other systems also. So it's so important to really peel apart those layers and then put them together in a holistic view that really allows optimal performance, specifically when you're in the performing arts world, where you're doing the same thing over and over and over and over again. So I absolutely love that. So question for you, Heather, what are the most common injuries that musicians encounter?
So it's really kind of across the board, but a lot of thumb injuries, and you'll see some hyper. So a lot of people tend to be a little bit hyper lax. That's kind of, I'm making up my own word, but tend to be a little bit lax in their ligament structures in terms of musicians in certain spots. And they can actually create ligamentous laxity as well from being in static postures for too long. So that was definitely one of the things that happened with me at my flute. So it's a matter of, thumb positioning, a lot of thumb pain, a lot of wrist pain tends to be something that gets irritated. I just had a patient before I jumped on here that was having wrist pain. She has chronic wrist pain for like 7 years, and she's in a funky position when she's at her instrument. So it's trying to slowly change some technique patterns as well. But a lot of big things is I always look up and down the chain, and it's all about creating that stable base up in your shoulders as well, and making sure that your posture is really, really in as good of alignment as you can possibly be, and have this as a stable support for everything else to work on. So even though a patient may come in with, a finger pain or a wrist pain or even an elbow kind of pain thing, I'm always treating them from a postural standpoint too, just because the mechanics of the instrument are always forward. So I'm always trying to open them up when they're away from their instrument and when they take breaks as well.
Got it.
So there's a lot of wrist sprains, which is a very generic term because there's so much that goes on in the wrist.
Of course.
So much that goes on in the wrist, and there's some structures that can be involved. But wrist strains are definitely one. And then what I find a lot is that musicians tend to kind of co-contract. So as they're playing, they're contracting other muscles that don't really need to be contracted. So as they're trying to, play their strings and depress their strings or their keys, they're actually not only using these muscles on this side, but they're contracting these muscles on this side inadvertently, and it becomes a habit. The habit sort of needs to be broken. So.
Got it. Now, do you find that co-contraction happens with experience? So novice musicians versus more experienced musicians, is there a difference with those two?
So I see a difference in instruments too, especially. So it happens a lot with guitarists. It happens a lot with violinists, cellists, and clarinet, saxophone. Those are the ones that I see it a lot with, is that co-contraction. And it happens, most of my patients are pre-professional and professional. But I have to say that when I look at the people that have come to me that are just more hobbyists, they're definitely, it can be there too. I've seen it there too. And that when it's there in hobbyists, it's usually because there's more of an emotional component going on and stressors inside their life that are making them kind of hold on for dear life.
Interesting.
So, go ahead.
No, I'm saying I was about to say that's really interesting. The comparison that I have for that is with that concept of co-contraction is what I tell my dancers when they're trying. It comes back to the way that you do motor learning to make sure that you have a very clear pattern of how to execute a movement. And when there's interference, meaning like I'm thinking too much about it or I'm distracted about 5 different things, and you don't have a clear motor neuron pattern to execute a motion, you start getting into these things, where all hands on deck, and I talk to my dancers about that, and I say, look at the babies. When you look at the baby class and they do a demi plie and they're like this, and they just have to bend their knees, but they're co-contracting, and then you look at an experienced dancer and it looks effortlessly, and I'm like, they have figured out the minimum requirements necessary to do that motion instead of everything. And a lot of that, as you said, comes from anxiety about the motion or for the other things interfering with the performance also. That's an interesting thing I would not have thought of.
It definitely happens with professionals. I see it a lot in professionals. I think that it depends on how in tune the professional is with their body too. And I think dancers have a tendency to be way more in tune with their body, probably than in terms of their movement patterns. Musicians are very in tune with their body in terms of when they're playing, but not necessarily what's actually has to happen in order to create that movement. Does that make sense?
Yeah.
So it's a little bit of a different philosophy. I always think of, and it's kind of cliche, but I always think of musicians as athletes, but they're a different kind of athlete. They're really not using their big, huge gross motor skills. They're really using their fine motor muscles and the smaller muscles to get the job done. And they're sitting there for like hours and hours and hours, really in one position more than anything. And they're just moving small motions, right? Whereas a dancer is using larger motions, bigger movements, though they tend to be the same motions, they're moving in and out of them more frequently than, say, a musician is. It's all repetition, but in a different way.
Yeah. No, that's a great analogy. And Heather, for reference, tell me the types of musicians that you see.
So I see mostly classical musicians. I see some jazz musicians, mostly classical, chamber music, orchestral players, and again, pre-professional. So a lot of college kids. There's a conservatory that's about 40 minutes away from me, so I'll get a lot of patients from there.
Got it. Okay.
Yeah, and then I don't see a lot of brass players. Brass players are a different breed.
Really?
They are, yeah.
And they're not doing as much of the fine motor movements?
They do have the fine motor movements, but I think they have a slightly different personality than the other instruments. I know that flute players and there's just a different mentality overall, I think. And if you talk with musicians that are in an orchestra, they all joke about the brass players, or they all joke about, like, there's always this banter back and forth between all the instruments, and they're kind of like personality, going on with that. So, but yeah, I don't see a ton of brass players. It's really more saxophone, clarinet, guitar, flute, violin, viola, cello, double bass. Those are the big ones.
Awesome.
Drum, percussion.
Wow, this is so interesting to listen to. Okay, so describe, now I think you answered a bit of this question, but maybe you can go into a little bit more depth, and maybe you can zoom in on a couple of injuries that people may be easily identified by in terms of musicians. So can you describe your approach in dealing with common injuries, that maybe one or two that you've encountered before?
Yeah, so boy, there's so many to think about. Which one is a really good one? So with musicians, there's some musicians that end up with dystonia. So do you have that in dance much?
Not a lot. No.
Not a lot. Yeah. So that's kind of like, you don't see a ton of dystonia, thank God, because it's something that's really challenging to treat and challenging to deal with as a musician. But I've had my share of dystonia patients, which is really a lot of neurological retraining and that kind of thing. But more common ones are definitely, so today I had a patient who's a clarinetist with wrist pain. So she had mostly thumb-sided wrist pain.
Mm-hmm.
So I go through all sorts of different tests to look at her. I do my traditional occupational therapy evaluation. It's very similar, it's a hand therapy evaluation that I would do to kind of pinpoint what's going on, what structures are involved. And then they always take out their instrument. And I assess how they play. So with her, I didn't find a ton from an objective therapy screening, a few little things here and there. But when I looked at her, when I watched her play, I immediately zoned into where the problem was, and it was more of a positional thing. And again, excessive pressure where it wasn't needed. And again, that tends to be a habit that gets formed that then kind of just turns into this process. And it's just, and the first step is becoming aware of it. So like her thumb tension on her instrument was super, super high. Like I couldn't even move. Like when I poked on her thumb as she was holding the instrument, it was like a rock. That's how rigid it felt.
Wow. Mm-hmm.
So I asked her, I said, how much tension do you think it is? So kind of like a pain scale, 0 to 10. She was like, I think it's about a 9. And as soon as she realized that, she was able to actually decrease the tension in her thumb when she played. And then we moved her position around in her wrist a little bit. And again, you have to make these changes really, really very slowly, because you're not going to take a wrist that's in this position all the way out here and move it to this position right away, because it needs to be more of a gradual thing, because you don't want to rob Peter to pay Paul, right? Mm-hmm. You don't want to fix one thing to have a problem come up someplace else. So it's a slow, methodical process. And then I send them home with like 2 or 3 things for them to work on. And when it comes to technique changes, body mechanic changes at their instrument, it's really, you have to practice really slow scales, arpeggios, long tones, nothing where you're thinking about the piece of music or anything else. You're just focusing on the technique changes and what position your body's in, so you can create that new motor pathway and erase the old one.
Wow, I love that. It's so methodical, and getting into the musical aspect of it, I think it really speaks to the performers in terms of understanding, well, when I'm playing when I'm playing a scale, like it hurts, but if I'm just, holding a long note, then it's not as painful, like things like that, where they can start noticing patterns and start connecting the dots of where their pain may be originating. And now from there, start changing the way that they're actually playing their instrument. That's awesome. Okay. Can you outline let's assume we have 4 amazing musicians that are listening to us right now. Can you outline 3 things a musician listening today can improve their pain and ability to pay? What would you have them do if they had to task 3 things to do?
So if they're injured, and actually even if you're not injured, the biggest thing I would say is you need to take breaks. You have to take breaks. Musicians are notorious for sitting down and practicing for hours and not getting up and moving. I was guilty of this. I would sit in my practice room for easily 2.5 hours and just practice and not get out of that position. So I always tell my patients, depending on where they're at with their pain level and everything, at least every 30 minutes, if you're doing okay and you're not really in an acute situation, every 30 minutes, you're going to get up and you're going to take a break. And it only has to be 2 or 3 minutes. It's just enough of a time for you to be able to get out of the deforming position that your instrument puts you in. You get up, you get a drink of water, you move your body, all right? You walk up and down the hall or whatever, do something a little bit more physical so that you're not in this position. You're kind of opening up and kind of moving around. So that way you get blood flowing again to all the other muscles that have been static as you've been playing, So that's the key. One thing is definitely you need to take breaks. And if you're in an acute injury, you're going to need to take breaks more frequently. And I never tell people to stop playing their instrument. Unless you're in a cast or you've had a tendon repair that you can't actually do something at your instrument, there's always a way to be at your instrument. It may not be the way that you want to be at your instrument. There's always a way to be at your instrument so that you're still connecting to your instrument in one way, shape, or form, because that emotional connection is really, really important. And when you tell a musician to rest, it's like, what are you, crazy? Like, So again, rest is one of those things. Are you going to play for 8 hours a day? No. But are you going to be able to change the way you play a little bit so that you're at least at your instrument for some of the time? Absolutely. Absolutely.
Mm-hmm.
The other thing is to be aware of tension in your body. I always tell my patients, scan your body for tension throughout the day, even and especially when you're at your instrument. So you sit down to play, where are you holding tension? And then to visualize actually releasing it. So in music, we visualize and we hear the note before we play it. It's sort of the same thing. Visualize what your body is doing so that you can release whatever excess tension you may be having, and be aware of tension that you're holding throughout the day, because a lot of times we end up posturing our body in funky positions. We don't even realize it. So as soon as we can become aware of that, that's a huge, huge thing. And then the third thing I think is really important, I have like a bazillion, but is to do a dynamic warm-up. Because whenever I ask musicians, what do you do for a warm-up? It's always scales, arpeggios, and etude, that kind of stuff, which is great because you do need to warm up at your instrument, but you need to warm your body up before you sit down to play your instrument. So I have a dynamic stretching routine that I created for my musicians. And it's just a really short 5-minute video that walks them through doing some dynamic stretches to get their body moving, their muscles dynamically stretched out rather than statically stretched out before they sit down to play. And it only takes about 5 minutes of their time, but that will warm up their tissues so that it can prep them to sit and play.
Oh, I love the idea of that dynamic warm-up. I think that's so important. I grew up playing the piano, never thought of warming up at all. That was for ballet. It was not for piano at all. So that's awesome that you have that resource.
Never. Yeah, I didn't do it either.
Yeah, it's so important. Is there anything that you can show the guys that are listening right now that would be a good warm-up, or a little bit of a component of that? Or is there a link that you'd like to provide if they want to get that information from you?
Yeah, so I have a Facebook group for musicians where I go in and I talk about all things that have to do with musicians and injuries and that kind of thing. It's called the Masterful Musician, and in there I share a lot of the different tips and that kind of thing. Right now I'm doing an interview series with a bunch of different things. And then in terms of dynamic warm-up stretch, it really, I think it's one of those things I'm always careful to give people exercises to do, not knowing what their situation is. Because for me, many things need to be adapted depending on the patient. So like we can all Google exercises, right? But we may not be doing them the way that's best for our body, right? We can actually hurt ourselves rather than make ourselves better.
Of course.
So, I can certainly, I'm trying to think of, when it comes to the dynamic stretching, I have people do a lot of, just some neck motions, some arm motions that actually include like a nerve glide where they kind of come out this way and then kind of come back in and then kind of come back out that way. And that just sort of warms up. So what it does, it opens up your shoulder and then it also stretches your flexors. And then when you come back in, you're sort of stretching your extensor muscles. And then there's some things where you can't see me because I'm sitting down, but I kind of do this where people come back. So you can see my wrist go back and then they come up.
Yeah.
Back. So you're kind of working those muscles in your forearm, but you're not statically stretching it because it's cold at that point in time. You want to warm it up a little bit before you do that. So those are just a couple of the exercises that are in the video. But the video is way cooler than me just sitting here doing it because there's like music to it.
No, this is awesome. For musicians that are online or parents of young musicians or teachers that are on, definitely check out Heather's work. I'll put a link in the comment section if you don't mind, Heather, so that people can connect with you and they can get access to that resource. This is amazing stuff, guys. It's all about being able to do the thing that you love, forever and the longest that you can, and not have the experience that Heather had with her instrument in terms of the flute, or not have the experience that I had when I was injured. It's all really about finding ways to increase the longevity of doing the thing that you love to do. So Heather, to wrap up, you had something?
Oh, sorry. No, I was just going to comment on that because I think it's so true. Like if I had known now if I had known then what I know now, I would have been able to prevent my injuries.
Yeah.
And that's key. And I think it's really important for people in the performing arts to realize that we have to be proactive as performers. Like you have to be proactive and not reactive, because we can prevent injuries if we're proactive. You know, every elite athlete has, you know, a routine that they do, nutrition that they do, a routine that they do, a warm-up that they do, ways that they do self-care, massage, whatever. They have a routine that they take care of their bodies. Well, it's the same thing with musicians. You need to have a routine to take care of your body as you do with dancers. So
yeah,
it's really important.
Yeah. All right. So a parting word for us, Heather, and how can we connect with you?
So I'm on Facebook. My group is the Masterful Musician. So people can certainly hop in there. It's a free Facebook group for musicians. My Facebook page is Healing Hands Therapy Center. And I'm not really on Instagram because I get overwhelmed with too many techie platforms.
Managing for you. I'm sure there's some musicians out there that need your help.
So I do have a handle, but don't even ask me what it is.
No worries. We'll make sure to connect guys with you on Facebook in terms of your Facebook page. And any parting words for us?
I think just thank you for having me, because I think the more we share our stories with people and our experiences, our expertise, that then the more we can actually reach people and prevent these things from happening to others, because it's not a fun road to go down. And though I think that my purpose was definitely to be doing what I'm doing, and my music served a purpose, and I truly believe everything happens for a reason. I think that, you know, there's definitely ways to prevent things from happening that don't need to happen. And again, it comes down to being proactive and not reactive.
Got it. Awesome. I love that you've shared your story with us and you shared your expertise and your time. Guys that are out there that are listening, please connect with Heather. She has amazing resources. She's an amazingly smart clinician. I can spot them a mile away, believe me. And really connect with her if you have musicians that may need the information that she has, or parents that are out there, because that definitely is a group of people that need to get this information, to get their eyes on their kids, and teachers also to understand a little bit more of the dynamics of the body and how it can really help musicians. Please connect with her. All right, Heather.
Thank you for having me. It was fun.
No worries. Thank you so much for joining us. Bye, everyone. Please message me with any questions if you do have it for Heather or myself. We'll definitely get back to you. But thank you guys for tuning in, and we'll talk soon. Bye, guys.